Okay, thank you, Peter. Thank you to the organisers for the invitation to come along today and to tell you something about our programme. Okay, here we go. Progress. So I've 10 minutes or so just to give you a quick snapshot before I show you the figures for the programme to date. Just some brief background on the industry, which is pertinent. So we have around 83,000 breeding herds at least. Around 17,000 of those are dairy. The remainder almost exclusively then beef suckler herds. Our dairy herds in around 70 cows as average. Our beef herds much smaller, an average perhaps of 17, and then a tail of larger herds within that. The programme is industry-led. There is what's known as the implementation group, which includes government, but also processors, farm organisations, the vet school, breed organisations, and so on. And it's really that grouping that takes all of the decisions around the programme. On average, one meeting per month. I think we're up to 83, 84 meetings to date. So that's a very active group. It takes all of the decisions in the context of the programme in terms of evolution, enhancements, and so on. The programme began with a voluntary year in 2012 and then progressed to a compulsory programme from the 1st of January 2013. And that was, I suppose, progressing from the voluntary programme, which really served as proof of principle in terms of the logistics of the programme, but also in terms of the level of uptake, which was sufficient then for government to introduce legislation at the request of the implementation group. And we've heard from Professor Dahl, there's a lot of common issues which I won't go into again, but in terms of our legislation, calves have to be tagged and a sample taken within 20 days. The sample has to be submitted to a designated testing laboratory. There's the option to do a retest if the herd owner chooses to do that. And at least animals born after the introduction of the legislation must have a negative result to trade. If they are positive or assigned a suspect status, then they are restricted as well and can only move directly to slaughter. So in terms of progress with the programme over that period, so we can look at this in a number of different ways, starting, I suppose, really at the bottom step in terms of animal level prevalence. So you can see the figures here, somewhat higher than we heard in Germany, but 2013, and we had about a quarter to a third of the calf crop screened the preceding year. So probably our true underlying calf prevalence was somewhat higher, but a year-on-year reduction to 0.09% currently. The other point just to note perhaps is that we, as I'm sure you're aware, a very strong bias to spring calving. So we're just approaching halfway through the year, but at this point we'll have around 80% of the calf crop tested. So peak of calving, week 7, week 8 towards the end of February, we'll have around 160,000 calves being born and registered out of a 2.3 million annual calf crop. You can see there are some differences if we dig down by herd type, for example. Actually more common, a higher prevalence in beef herds than in dairy herds at the individual animal level. But again, a year-on-year reduction. If we look at the herd level as opposed to the individual animal level then, which is our next, again, we see at the start overall around 11% of herds turning up animals with initial positive or inconclusive results. But at herd level, switched the other way around now. So around 20% of our dairy herds testing positive in the first year, lower 8-9% in the beef herds. But again, a steady year-on-year reduction within each of those. If we look, this is the distribution of those positive animals across the country in 2013. Just really makes the point perhaps that they were distributed across the country. There was nowhere really bar mountains, rivers, cities that didn't have them. And this is the parallel map then for 2017 to the end of May. So again, we can see a good reduction. And in terms then, the other metric is the number of PIs that are actually still alive. So the map on the right is those born in 2017 detected. The central map then is the number of those that actually remain alive. And as I'll comment on in some of the remaining slides, actually driving that number down in common with the programme in Germany and all programmes, the identification in some ways is relatively straightforward. It's the removal in the absence of compulsory slaughter and associated with that compensation. The other point that we note, and I was pointing this out yesterday, this is County Carlow. So that's our first county that at the moment at least is BVD free. So hopefully as we go through the year, actually that will fill out a little bit further. As we move then from animal to herds, we can, and as we've tested over the course of the programme, so we have in those 83,000 breeding herds just over 6 million animals. And the majority of those, excuse me, now have either a direct test result because they've been tagged and tested, they've been born within the lifetime of the programme, or they have been assigned an indirect negative status on the basis of producing 1, 2, 3, 4 negative calves. And we are using that then as the basis to assign herd statuses. And this is where that stands at the moment. So 65,000 herds have got what we refer to as negative herd status on the top, and that's on the basis of all animals in the herd having a negative result, and there having been no positives, no PIs in the herd in the preceding 12 months. So everything is negative, both live and there should be no PIs in utero. The group at the bottom, 14,000 herds, typically contain 1 or 2 unknown animals that have not yet been tested. Those may be animals, in most cases, that have been born actually before the start of the programme, older bulls and so on. And that's a group that we're keen to move. Interesting, again, picking up on the biosecurity message which we heard from the German programme, again, I think common to all. So in this group, we do see year on year some herds that have previously been negative that have acquired NHS negative herd status, but that do then go on to have PIs. The risk for those herds is much lower than herds in these two categories, but nonetheless, those are obviously breaches of biosecurity, introduction of virus from outside the herd. In terms of retention of PIs, this has been a particular problem, probably the key problem that the programme has faced, and one of the key challenges then that the industry group has had to address. So this figure just illustrates the well, firstly the problem, but also the progressive improvement. So the figure here is showing the survival curve for PIs born year on year. So the blue line is for 2013, 2014 and 2015 in the green, and it's showing this is time from the initial test and then the proportion that are still alive. So for example here at around 200 days, so 6 months in 2013, we still had around 30%, 33% of PIs that had been identified in 2013 were still alive. As we come to 2014, 2015, you can see that's improving. And again, if we drill into that a little bit further by herd type, in particular in 2013, it was beef animals. In the subsequent years, that has actually improved so that beef and dairy are more similar. And there has been an evolution of messages within the programme and of carrots and sticks to drive that, and we can touch on that as I wrap up. Another key driver for the programme has been the development of a national BVD model, which has allowed us to ask some key questions and really has been instrumental in informing the implementation group as an objective outside measure, particularly around retention. So this figure illustrates if the level of retention that we saw in 2015 had continued through, how many PIs would be being born year on year. And I suppose the bad news is that through to 2022, we would still be somewhere between 1,000 and 1,500. The target is eradication by 2020, and clearly on that basis that would not be achieved, and certainly that has focused the mind of the implementation group. On the other hand, if we have prompt removal within 7 weeks, then by 2020 we can certainly get very close to that, if not achieving it. And really on the basis of that and some other information coming to the group, then there have been some key changes to the programme for 2017. And just briefly to summarise those, so there was a discussion ongoing within the implementation group, firstly about the availability of other testing options, specifically serological testing within the programme. That has not been introduced, at least in 2017, so all herds continued to tag test. There's also been an increased focus then on removing PIs. So up until 2017, an animal was deemed to be retained if it was still in the herd 7 weeks later. For 2017, that's now at 5 weeks. There are some financial supports for removal, which you can see the figures on the next slide, but those have been increasingly front-loaded to the first weeks following identification of the at least the positive calf, and really seeking, similar to Germany, to seek to discourage retesting and encourage prompt removal. So as much as possible, removing those cows within 3 weeks. Confirmatory testing this year is only available through a blood sample taken by the vet. Previously, tissue tagging was also available. And there's also this year mandatory herd investigations funded through the Rural Development Programme for all herds with PIs. And again, that gives us very detailed information in terms of the biosecurity profiles within those herds, and gives us very good feedback then to plough back into the programme. Another important one at the bottom here is that for 2017 there's automated restrictions placed on herds that retain PIs. So on the government database, as soon as and an animal again is PI until it's proven otherwise if it has a positive. But as soon as that animal is present for more than 5 weeks in the herd following the date of the first test, there's a restriction placed on the herd. And that's both in terms of moves into the herd and moves out of the herd. And in parallel with that, a separate study has shown increased risk to neighbours if there have been positives in an adjoining herd. So on the basis of that, there's also a notification issued to all of the neighbours of that retaining herd, advising them to review their biosecurity. And in terms of those supports, briefly just, there's €185 for beef animals that are removed within 3 weeks, falling to 60 if they go in the 4th or 5th week. And in dairy herds, it's 150, falling to 35 for heifers. And for the first time this year, also a €30 contribution to bull cows if those go within 3 weeks. So how have those impacted the programme? Well, so the red line here is the number of 2016 born PIs alive, the green for 2017, the blue, and then the green is the cumulative. So for those 2 years, this is to last week, there was just over 200 PIs alive in Ireland. The figures actually we've just got this week's through, so it's down again. It's down to around 170. Given our calving profile, where almost all the national herd goes through the risk window for creating PIs at the same time, so the majority of cows calve February, March, the breeding starting April and into May, it's critical that those PIs are identified and removed promptly. So we're certainly encouraged by these numbers. Again, if we look at those that are alive by birth month, we can see that they're now concentrated into the months immediately preceding. And in terms of the number of herds that are retaining PIs, so present for more than 5 weeks, compared to last year, 221 in week 25 down to 34. We would still prefer that 34 to be 0, but you can see that's multiples of reduction compared to the change in the actual percentage of PI cows being born. So again, I think in combination, those measures are having a significant impact. So I'll leave it there. A lot of this information and more is on our website if you're interested to look further there. But I'll leave it there. So thank you.
Thank you very much, David, for a very clear talk. Questions, anybody, on how the scheme is going? Jenny?
Can I just ask you?
Sorry. Can you read through so quickly?
Thanks very much. Okay, thanks. Yeah, I just wondered if you could talk a little bit more about the veterinary investigations that are done for herds that have PIs. Which vets do them? Who funds it? How does that work?
Yeah, so the veterinary investigations are funded under a rural development programme which is known as TASA, so Targeted Advisory Service in Animal Health. Those are delivered by vets who have been trained by Animal Health Ireland. There's a particular structured approach that's taken to that, which involves using the programme database where there's a number of investigation tools built there, and also an on-farm component. And it follows essentially a four-step process. The majority of herds that have PIs have a single, possibly 2, 3, but 95, 96% have 5 or less. So typically it's a small number that are being investigated. So it is, the first question is, when did it become PI in utero? Where was it? And based on that, then going through a series of potential sources either within the herd or outside the herd, based on what we know of BVD and epidemiology. As part of that, as the vet works through that process, and the vet is nominated, is selected from that trained list by the farmer, they go through a series of biosecurity questions and reviewing biosecurity around purchase, quarantine, boundaries, visitors, all of these various factors. All of that is captured as part of the investigation and then is fed back to AHI onto our website, where we now have, so for this year there's about 600 of those have been conducted. There was about 1,000 last year. So we get very good data then that we can analyse by herd type, by herd size, looking at these various behaviours. Some questions in there about attitudes, beliefs around retention of PIs and why people are doing that as well. There is also within that then there's obviously the advice piece which is given to the farmer, and that's critical in terms of encouraging disposal. There is the ability to identify, so are there unknown animals within the herd? So is there potentially an unrecognised within herd source? Those are identified and have to be tested within the investigation, and so on. So it's looking to identify plausible sources. It's looking to ensure that the herd is left BVD free as much as can be, bar possibly anything that's in utero, and then putting in place, based on the review of biosecurity, agreeing up to 3 key recommendations that the farmer can put in place for the next season to minimise the likelihood of a reintroduction.
Any other questions? Yeah. One more.
Yeah, I'm Bill Mellor, Chairman of BVD Free England. I assume this is all being funded by the Irish government, am I correct?
You're incorrect.
Right. So please explain.
So the programme is industry-led, and essentially industry carries the majority of the cost. So the testing component, all of that is paid for by the farmer, bar where if there's a confirmatory test, that is funded by government and through the NRL. There's some other government monies go in as well. So obviously the payment of these supports, which is relatively modest amounts across the programme, but nonetheless the payment of the supports come from government. The government also fund what we refer to as the BVD help desk, so it contacts farmers, it does the linkages around TASA investigations and so on. But the bulk of the costs within the programme are carried by the farmers, which are really the testing costs.
What would be the actual involvement of government, and how much is government contributing? I mean, the biggest contribution, I presume, will be the payment for the removal of the PIs.
I couldn't put a definite figure. If I was to pluck a figure from the air for this year for payments in terms of removal, perhaps 200,000-300,000. But I would really need to sit down and look at the numbers that have gone within the various time windows and multiply that up. But that's the sort of magnitude that it has been. Obviously, there's other costs associated with running the NRL, provision of the help desk and so on, but the bulk of the testing certainly, the bulk of the cost is carried by government, is carried by industry.